standing up our data operations. So the two of us will be presenting today. We presented about this time a year ago and told you about our plans for turning on the machine with all the data that would be on it. Well, our machine is turned on with a lot of data, and we are open for business. So a lot of what we're going to do today is go through a lot of what we did last year, but in the context of being open for business, but also I think most importantly for many of the people in the Zoom room who are thinking about submitting a pilot for the Head Center, but also for the HBHI pilot program. And using some of our data, you might have a lot of questions about what's there and how to get access to it. So it's really in the context of action. So we have some slides that kind of go through the why and what's there, but I think we want to leave a lot of time for some questions. So Frank will share his screen. I'll go through a few slides of just kind of general hand wavy kind of stuff. And then we will dive into some of the details, and Frank will take over for that. But let's make this informal. Feel free to ask questions along the way. Anything that comes up. I don't know if you want to use the full screen mode there, Frank. Not that. This is fine. So you can go to the next slide. So just to give you a little sense of, okay, here we go. I'm going to move on to slide number 2. So just a little introduction. Oh, I think you had it there. So we have this remote data on. I'll just start talking as we set things up. So the goal here, we call it, there are kind of many names for how we facilitate access to right now it's mostly for claims data, but it really is for, the infrastructure is set up to continue to expand, but we really started this venture with the need to not only, there are a number of places around Hopkins that are generally accessible remotely from across the university, and really also from people that are connected to the university but maybe sit outside the university, to access a number of data sets that are open but also licensed to the Hopkins community. When it comes to CMS claims data, it requires a level of oversight in terms of adherence to data use agreements and other security requirements that really didn't exist on any platform at Hopkins. So we set about to create this Hopkins-wide platform for data collaboration that involved using CMS health insurance claims data. But this platform can be scaled up for a number of purposes. And what we're really trying to do is facilitate research collaborations and building the work of data centers that depend on health insurance claims data or other large data sets, such as the Head Center. So we've overcome these privacy security needs to get kind of general access to CMS data. And we are really at this stage, since it's been turned on this summer, is focusing this larger platform on facilitating research for the HEDS community on ADRD research. Really leverages, given that most people with ADRD are over 65 and the CMS data are largely most complete for the over 65 population, it's really a natural match. For the folks that are more connected on the Hopkins Business of Health initiative side, there are a lot of questions that I think are great for collaboration with Alzheimer's disease questions, but also questions on its own. And And there are just a number of other research communities that could benefit from this, and we're looking over time to scale up for across other research communities as well. But the investment to date has been from the Head Center and the Business of Health Center for setting this up, and a lot of the access before we develop a sustainable business model is really being funded through the investments from these centers. So that's kind of the message, that we're open to wider array of topics, but we're really set up to really run within the Head Center within the HBHI community. So one brief comment is, some people say, oh, why don't I just run my project through the CCW VRDC, and I just can portal in and get access for my project. And a number of people do, especially in smaller universities where they're the only one using claims data. But the advantage of purchasing data directly and licensing it to Hopkins and working from our center is that you're not just paying for a seat for you to work by yourself and using this remote data enclave, but it can expand to your trainees, to building collaborations more broadly. So it's kind of trying to make the whole greater than the sum of its parts by people who are developing projects using this data enclave, this research environment that allows for expansion and leveraging just the broad array of research happening around campus. So that option, it doesn't close off the option of using a remote data enclave for CMS data, but it becomes just not a very cost-effective way to organize research going forward now that we have this data enclave here at Hopkins. So let's move on to the next slide. All right, so this goes by many names. We are the, from the perspective of the Head Center, we're called the RDEC, Remote Data Enclave. So if you have any questions that are directly related to using data through the Head Center, we're really dealing with the RDEC. We're really trying to also create a platform that's university-wide, and so the kind of larger infrastructure, which is really the same infrastructure by another name, but for other purposes that fall outside of the, what would be under our grant and our objectives for heads, can be serviced through this larger HARP platform. So it's a way we can build capacity and build scale university-wide that might sit outside of the specific objectives that are funded through the National Institute of Aging. So that's just kind of why we have these weird two names. And hopefully we'll have more names as more centers want to participate. So what do? We have hardware, and we have licenses for R and Stata, SAS, and whatever other platform, other things you might need to do work. We can get those as well. That work off this server, high capacity server. We also build and maintain a data warehouse from all the licensed products that not only sit on that particular server, but may be related and sit at other places, kind of a one-stop shop to find data that you need that are licensed to the Hopkins community. And we provide services for access, helping with data use agreements, purchasing data, getting the training you need to use the service, to get on the enclave. We have programmers that are experts in using these data. And if you hire your own programmer or you're trying to learn on your own, there's just a community of experts that can be tapped in. So it's not like everyone's starting from scratch every time a new research group enters this world of data. But the main point here is we're open for business. Next slide. So I think I'm gonna I guess this is like really a setup for some examples of projects about the focus, like the kind of work that can be done. So over the past year, we've known this is coming, and we've been funding through the Head Center projects that use claims data, some of which are using our enclave directly and some somewhat indirectly as we build going forward. So the reason the Head Center is invested in this research data enclave is to provide the resources necessary to develop the researchers committed to understanding the full range of care needs and advancing accessibility, affordability, quality, and equity of care for people living with dementia. And in a sec, I'll show you some of the projects that we've been investing in through our pilot program that connect to these type of data. The Hopkins Business of Health Initiative's vision for the HARP is to bring together researchers from across Hopkins who use or are interested in using health insurance claims data for research to develop the critical mass to advance research on national health system related questions tied to affordability, value, and equity. So these are very much intertwined objectives. Next slide, please. So for the some very quick bullets, some of the projects that HEDS has funded just in the past year use claims data. Many of the people that are funded through these projects are on the call. And as they can tell you, they're not all using the data we currently have available on the data enclave, but the type of work uses claims data. So number one, understanding gaps in care and reimbursement for diverse populations with Alzheimer's disease and related dementia. It's claims-based analysis using the Fair Health data. I think last month we presented on all these very quickly. So I'm just gonna kind of leave those bullets up there. There's a claims-based identification of ADRD between Medicare Advantage and traditional Medicare. Home health utilization in older results, comparing in older adults with dementia, comparing traditional Medicare, Medicare Advantage. Understanding retail pharmacy use among Part D beneficiaries with Alzheimer's disease, and examining trends in medical ventilation among veterans using the veterans data that are accessible through the VA. But all really, so we funded 6 projects, but 5 of them use claims data for their work, and so there's a huge opportunity to ask questions that are directly over the plate for the Head Center that use claims data. And as you can see, 5 to 6 projects from last year were projects of that type. So it's a huge role for expansion going forward and leveraging our assets directly now that the lights are turned on. Next slide, please. So HBHI has funded 3 claims-related projects in the past year. Plans, providers, they have a cute title, Plans, Providers, and Patients, Oh My, the difference in use of life-saving treatment for opioid use disorder between commercial insurance and Medicaid. So this is leveraging state-level discharge data that are all payer claims, include Medicaid and commercial insurance as well. A double-edged sword, examining the relationship between patient satisfaction and physician overprescribing, so linking Part D data to scrape data on star ratings for physicians, impact of Medicare Advantage on quality of care, evidence from osteoporotic fragility fractures, so looking at things like prior authorization in Medicare Advantage. So I'm going to now, so that just gives you an example of some of where we're headed. But let's just get into some of the details of the data itself, which you've all been waiting for. So I'm going to turn the mic over to Frank, who can go over some of the specifics.
Okay, great. Thanks. Can everyone hear me? Okay, thanks, Dan. So I hope everyone is excited about the potential of this platform we've been building, and to learn about the data we have access to and we support. So our core assets is really restricted CMS, Medicare, and Medicaid claims data. And we also, provide support for our investigators to access CMS claims linked survey data. And we also have some of the Hopkins license data set that we can share among this community. And then a group of our heads colleagues have developed a framework for contextual data on long-term services and support, which will is complementary to claims data and would be very helpful in claims-based research. And we also interested in learning about your interest in any of the new data set that may be helpful for this community. Excuse me. Okay. So for CMS claims data, so in general we have the Medicare Advantage encounter data, the traditional Medicare claims data, and the prescription drug claims. So some of you may be very familiar with claims data, and some of you may not be so. So please feel free to jump in and ask questions as I go. And we also put in a link in the title to some of the learning resources to RASDAC, and you will also have this slide deck. So to give an overview, so there's Medicare Advantage encounter data. We have all parts of the data. We have professional services claims data, the Carey file. We have outpatient hospital services file. We have inpatient hospital stays file, and we have skilled nursing facility services and home health. So the outpatient, inpatient, SNF, and home health are all 100%, although we are not sure if going forward CMS will be allowing us to buy 100%. And for Carey, we are we're also getting a large sample of the professional services file. We that covers about 12 million MA beneficiaries, which is about half or over half of the total Medicare Advantage enrollment, depending on the year. And to go with all the claims data, we have the enrollment file, the master beneficiary summary file that contain basic demographic information and plan enrollment information for Medicare beneficiaries.
Frank, can I just interrupt for a second? I guess I'm interested in, I don't know if people want to put their hands, kind of virtual hands up or something like that. But I guess it's just, one of the things that we would like to do if there's a need for it, I think, having grown up with CMS data, all these like FFS, inpatient, outpatient, it's almost, for me, it's like my language, but I imagine it's a foreign language for many people in the room. And so if you have an interest in learning about claims data, but you're really at the beginning and all these words just sound like a foreign language and you want to learn the terminology, like, claims data 101, there are kind of online tutorials. We could do a tutorial ourselves. And so to kind of put something in the chat or raise your hand, if that's really where you're at, if that's where your needs are, this talk is really letting people know what we have for people who are ready to kind of get started. But if you're getting started is to learn the language and kind of go through step one, this is just to know that there's a kind of a low cost opportunity here in the HEDS environment to invest in this style of research. So if you want to make that investment from the beginning, this talk isn't designed for you, but we can design that talk. So just let us know. With that being said, I'm going to stop my commercial for a potential future talk if there's interest and turn it back over to Frank.
Yeah, thanks, Dan, and that's a great point. And I'll also add that we will also we are thinking about not just one workshop, but a series of workshops that can about a range of data sets that people in this community are working on. Kind of you can invite researchers or analysts who are actively working on these data, the claims data or kind of IQVIA claims data and HCOP data like these, and to kind of give people an introductory workshop on this. And we kind of it's one of our broader agenda items. And so on the kind of traditional claims side, we have a similar structure, but kind of the sample size is a bit smaller. It's like the standard 20% sample we're getting for professional services, outpatient, home health, and inpatient services. And there are a few data sets that that include both Medicare Advantage and traditional Medicare beneficiaries. We have their prescription drug claims. We have the hospice services file for everyone in the Medicare program, and we have MedPower file for everyone, which contain information on stay level, hospital stays, and nursing home stays. And we also have a physician level file, the MDPPS, which includes every individual provider who bills the Medicare, and it includes their specialty information and the locations where they practice. And we are very excited to announce that we have recently been approved to have OASIS files by CMS. So we have basically have home health outcome and assessment information data set for everyone in Medicare, and we are waiting for the Medicare MDS data sets, in which we hope will arrive in the next few weeks. And this is also something we are really interested in. We are and we are very excited about is Medicaid. We are going into the Medicaid territory, and we are starting with 2021, and we acquiring 2021 Medicaid data for all the states. And this is a major investment, and we are trying to build an entire research community around Medicaid data as well. And I would like to talk about how we can help you access these data. It's a lot of data with very rich information, so there's potential for the data to support a lot of research projects. But how it works is really with CMS, really they want you to have a data use agreement for the project you work on, and the use agreement kind of determines the scope of work that's permitted to do under it. So, for example, if you have a DUA for studying healthcare use of people with dementia, you can use that to study healthcare use for people with heart disease. So you would need specific DUA to cover the specific project you work on. And some of you may have gone through the DUA process, and some of you may not. But this is getting a DUA with CMS is complicated and takes a long time, more or less 6 months. And our goal here is to really make it easier for folks in our community to access CMS data. And we do two things. One is to manage the DUAs we have, and the other is to provide support for your DUA applications. So if you have an idea, please come to us, and we can figure out if your project fits under one of our existing DUAs. If it does, we can build a bridge between you and the DUA team, and you potentially be able to join the team and work under that DUA umbrella. which will give you fast access to the data. And but if your project doesn't really fit any of the existing DUAs we are managing, we can provide support for you to apply for reuse DUA, to use the data on our server for different purpose. So because we have jumped through all those hoops with CMS, and so what we can provide you is we have a CMS approved server environment, so you don't need to kind of build your own workstation, get CMS approval for that environment. We have an existing one, and we can provide you with application samples for DUAs, and we can provide you with guidance along the way. And so there are situations where you probably need additional years of data or different files. We can still help you to kind of reuse the existing data that you need, but at the same time we can support your DUA and support your purchase of this additional data, which I would kind of discuss more toward the end about the services we provide. And so one thing to note about the claims data is claims data are great. They basically contain everything about healthcare use for individuals. But what claims data are really lacking is information such as detailed education, life history, and socioeconomic information. That's where survey data might be really useful in some circumstances. And we just want to kind of let people know about the two very widely used and important types of survey data linked claims data. One is the NHAS CMS linked data, and the other is the HRS CMS linked data. Each of them are based on the survey, and they are linked to a bunch of Medicare claims and Medicaid claims. So the one difference is that with HRS, their Medicaid claims is kind of a little older. They don't yet, at least the last time I checked, they don't yet have the most recent TMSIS Medicaid claims. What they have is the max version, which is a few years old now. And so what we can help you with the claims linked survey data is really we want to point out that we don't house these data. The access is on a remote enclave that's maintained by NIH. But if you go through the DUA process, the access will be free of charge. So what we can do is we can provide support for you to apply for DUAs to access these claims linked survey data, because we also have experience with that. And one thing I would note is that if you are doing a pilot project with either HEADS or HBHI, would advise you to kind of start early before the official project start date, so that you have a little buffer time before for the DUA process before your project really starts, because these pilot projects are only 1 year. And so next, I would like to kind of give an overview about some of the Hopkins licensed data sets. So we have the IDEON, which is used called Faircrat, provide network data for the 3 major markets: Medicaid Advantage, the ACA marketplace plans, and Medicaid managed care plans. So for each year, the network data kind of have a list of all the providers that contract with each plan. So that gives you an idea about which providers are included in the networks of a plan. And we also have just purchased new One Key Health Industry database for 2021. It includes a much broader set of providers than the 2019 data we used to have. There's physicians in the data sets and nurse practitioner, physician assistant, but we also added advanced practice nurses and behavioral health providers such as counselors, psychologists, and social workers. And as usual, for all these providers, we have all of their associated organizations in the data. And the third one is AHA data, which is also very widely used, for studies that involve hospitals. It's a detailed, survey of all the characteristics of hospitals in the United States, and we have, data from 2005 through 2021 through, the Johns Hopkins Library. And finally, about the current data we have is I would like to also introduce everyone to the a framework that's developed by some of our colleagues at Health Center. They've developed a framework for understanding how the long-term services and support environment impact access, quality, and for of long-term service and support, and for adults and family caregivers. And they've put together all these data sources, ranging from demographic information to state and local level policy information to characterize the environment that's faced, by people and family caregivers needing long-term services and support. And if you're interested, there's an active work group that's working on this data. And if you're interested in joining the group, please contact Cheney Fabius, and I put her email here. And I would like to kind of take pause to see if people have any reactions or any suggestions on what data we might be acquiring that would be helpful for this community. You can also put that in the chat or send us an email if you have any suggestions. And
or any questions more broadly that Frank, I've been working on the chat with all the questions that are coming through. If anyone that's put a question in the chat wants to speak up or have any other questions or suggestions before we move on to the final part.
Thanks for monitoring the chat. Still a lot of discussion there.
Yeah, so I'll bring that up. Like, I think both from John and Preeti, one of the questions was, in this collaborative environment, seems some people on the call would like to, be on an active project, potentially, and it's unclear how to make those connections. And so I'll say, for the project, most of the projects that we're funding here are of the pilot variety, fairly small, trainees, people starting out their careers, not really looking to, kind of launch something that has a really large team or funded for a larger team. But, I think for, people with very specific skills, there might be, from a kind of training perspective and a mentorship perspective, some needs that are not currently met, and we'd like to know about them. But I think on the other end, about what a typical team, so that's what a typical team makeup looks like. and why probably, reaching out for big collaborative projects are not ideal in this kind of pilot environment. But one thing that Frank mentioned is our work group. Joining a work group on contextual factors where we try to generate new research ideas. We do the same thing in Medicare Advantage. Would be a good place to just kind of pop in and see what's going on and learn about the people involved. And so that's another way to kind of get involved at an early stage in the environment of people working on projects more generally, or working on project ideas. Launching new projects is probably a good, if you want to jump in and start to build connections and collaborations, I'd say it's through these work groups that is probably the best place to start.
Move on.
Oh, Jennifer?
Jennifer has.
Yeah, so thanks for a great presentation, and it's nice to see the chats and comments. I guess I've added that the contextual factors working group meets the first Thursday of the month. It's hybrid, so we have some folks who join us at Hopkins and others who join from other institutions, and have used that as a way to sort of spawn new collaborations, exactly like you said. I wanted to just ask how folks could learn about the Medicare Advantage working group, and or say that we are happy to be a vehicle for others who may have their own working groups. If you're looking for new collaborations and students, please let us know. We can be a broker for you.
Thanks, Jennifer. Is that question from Andrew? I'll try to tackle that one. Any future access for commercially insured? The place where there's been some action is with all-payer claims data. I think there's a state of Wisconsin that was just purchased. A couple other people might be working in that space. Some of the other well, we should talk. So I would say that the quick answer is nothing probably in the next year, unless you want to like get the money to jump into like HCCI or something like that. But getting with one exception, we have market scan data, which are free, or we pay for it through HBHI, but a number of groups across Hopkins pay for it, and those data are accessible. The market scanner is really the best kind of option for commercially insured. There are other more expensive options that are kind of one-offs on projects. I love the questions coming in here. Would a large DUA be available for things such as a UK biobank or integration with those that have UK claims? I mean, that's really would be a great, if that could be added to our environment, it's something we could facilitate. If you have some ideas there, it seems like a conversation we could, pull offline. I think that's very interesting. It sounds like a useful data set for things that would be beyond, like much greater than the questions that HBHI or heads, but would be of interest to people in epidemiology and in school of medicine as well. So I'd be happy to talk about that. There you go. Thank you, Conan, HBHI. I'll give you the link to our website. No one wants to speak up aloud. I got to read these questions here. Getting interested in getting more of an introduction to claims-based research. Master's students. I would say too, like for master's, this is a great question, Benjamin. It's I think the way it's worked best for the master's students is, I get, contacted all the time by master's students. Are you working on a project? I'd love to just, be a part of what you're doing. It's hard. Often people who do that get a lot of, not the timing's not right. I'm not working on something, but eventually you hit on a a research team that's working with these data and could really use someone that has, a particular set of skills, and you jump onto a project and you kind of learn almost like shadowing a project or something like that, or bringing your specific skills to that. That's what I would recommend. It's not easy finding that match across the, the institution, but I guess within heads, specifically, just kind of contacting, Chase and sending your CV, and we can pass it around and see if there's a way for students with a specific head's interest to start connecting with projects that are ongoing. It's kind of like a matchmaking might be a way we can facilitate what you're throwing out there. But thank you for asking that.
Yeah, I'll ask a question audibly. What are the compute kind of resources available? Maybe I missed that.
You want to take that one, Frank?
Well, I would like to say, I'm not kind of a super technical person, but I would just say, we have, a server with two kind of compute nodes, which is, where you run your statistical jobs. We have 100 terabytes of space on the server for data storage and for, the files you generate as you, work on the data. And the two nodes that for data analysis they each have 512 gigabytes of RAM space, and I don't even know the CPU kind of configuration of CPU, but they are fast.
Yeah, maybe that's a simple way. The people who have worked on this server and have worked on other servers are like, wow, this is like, it's amazing how fast it is. So that's about the most technical way I can describe it is like, wow. But one thing is we did not set this up in kind of a data science, machine learning style of work. It's really kind of input-output efficiency, kind of running more traditional statistical algorithms off of data, rather than, the kind of heavy RAM, heavy computational processes that would involve, much more expensive, elaborate machinery like AI. It's not like set up for that style of research.
I'll also add that as we can, we are, right now, we have 3 DUAs and we are a small kind of group at this moment. So, the resource, the storage space we have, and the computing resource are, not kind of utilized to 100%. But if we kind of are, getting to the limits of our capacity, we'll also be kind of adding storage space and adding RAMs and CPUs to the server, and we are just starting to see, we have a plan to kind of expand as we need. Any other questions? Excuse me. Okay, yeah. We'll start sharing the slide again. Okay. Probably left this slide on for a while, so people have already read through them. But here are the services kind of we provide. So first we maintain this hardware for for researchers on on our platform. maintain a secure server, this secure environment that's approved by CMS. And when you need to write a grant, we can provide you with a description of the research environment to go in with your grant. And we work with researchers to build our data assets. As people getting new data, they will be housed on our server, and through kind of reuse agreement, they can be accessible to other projects for other purposes. And as I mentioned before, we can support you with your DOA applications, and to make the process smoother for you. And because it's what we have is I probably mentioned that earlier, but in my answer to Ian's question. So what we have is a Linux-based server. So it's so we understand that it's not kind of natural for most people. So when you or your team members join our server, we'll provide the necessary training, include how do you navigate a Linux environment, and the CMS required data security policies, provide the training for you and your team members. And we if you need new data to be delivered, we can also kind of help you upload the data to the server and make the data available for your team. And finally, there's one thing that we are particularly excited about as we are building this critical mass that of researchers working on on this data, is that we are we will be supporting learning and knowledge sharing among the community of researchers working on this data. And so there will be work groups, as Dan and Jennifer mentioned, and there will be also people who are more experienced with data, with that you can reach out to about specific questions of the data, and they will be happy to share their expertise and knowledge. And if and for analysts and researchers who are just joining this community, we can help you also with to develop understanding of the data, and and everyone in this community will be able to share their expertise and help each other with troubleshooting. And then I'll turn it over to Dan to talk about the money stuff.
Yeah, I'll talk about the money stuff. So if you're accessing these data as a pilot grantee from HEADS, it's funded through through the center. Similarly for HBHI. Our goal over the long term is to make this self-sustaining. The capital that came from these two centers may not be there forever, and the need extends beyond these two. And the goal is to make, for this to really work over the long term, it's a community asset and involves kind of everyone being a part of it. And so our goal is to set up a what's called a cost center through the university. And there's certain rules for setting fees for a cost center that are kind of generated, like think of a cost center like the group that runs the lab of mice for experiments and in the School of Medicine or something like that. Everyone pays the same amount per mouse. So we have to kind of set a pricing structure that would work under that same set of rules. We're not under that setup right now because we're really focusing our access through these two centers that have some capital that's supporting all these services, the machines, the security, all the privacy and training needed to get these things going. It's not cheap. But over the long term, we want to allow anyone who wants to use these data to get on, and that's going to require money that wouldn't come from these centers that are restricted to pay for access only for through the the charge of the center. So that's where we're headed in the future. So if you're writing like an R01 on your own topic, or you got a pilot and now you're writing an R01, what we're asking is that you put in, or in any other type of grant, that you put in a line to say that there's like I'm going to be using these data, and I have $2,000 reuse to use these data, not tens or hundreds of thousands of dollars to buy data fresh, but $20,000 a year to cover the services of the data use agreement, the review of data, input, output, the security, the servers. We'll eventually have a detailed fee structure once we kind of officially set up our center. But we don't need to officially set it up until we have enough business. So the goal is for people to think ahead as they write new grants to budget us in. By the time your grants come in, we will be ready to set up shop with a fee structure. And the fee structure will be set up based on, right now the fee structure is based on 3 elements: how much data you take up, so everyone gets kind of an allotment of space, how much CPU time your team is running on a quarterly basis, and how many members of your team are working within your unit. And there's a shared cost that's a fixed cost of the staffing involved and all the costs that go into providing these services and running the servers on the kind of technical side, and on the access side that will be split among the full set of users. And so our projections are, depending on the size of your group and the amount of space you need, the amount of people on your team, that is going to run anywhere from $10,000 to $20,000 a year, which is a far cry from buying all the CMS data from scratch. So that's where we're headed. We're not there yet. Now think about access really through the Head Center, getting a pilot up and going. But if you're writing your own grant and you want more details on where we're headed, you make these investments for your kind of future research agenda using claims data, just reach out and we can provide some more details on those costs. And we're at our last slide. I just got a time check from Chase. Well done, Chase. So we can take any final questions, any general thoughts in our last couple minutes. So before we sign off, I just want to